Okay, it's Dr. Buford. We're just getting started on your right shoulder. We're looking in from the back to the front. Keep shortening that balloon a little more. Everything you see is magnified 30 or 40 times, of course. And just to show you what we've already seen, you do have this large defect in the rotator cuff that you can see here. You can see the old suture material. This is old rotator cuff all right here. So we're going to get to work on anything that we have to do inside the joint we'd like to do first, whether it's releases or making sure there's no chondral flaps that we can easily smooth out for you, which is what we're looking for now. Right now the camera's coming in the back of your shoulder. That shaver that you see is coming in from the front. And your glenoid, or the socket part of the shoulder, is down below. And the humeral head is up above. So you can see you've got a fair amount of degenerative changes in the cartilage here. There's just one more little chondral flap I can see back here. Okay. And so now I don't think there's really much more we can do inside the joint. We're going to have a look around, but the rest of the capsule looks intact until we get up here to the rotator cuff tear, this big tear right here. Okay, so I think we're going to finish up inside the joint. There may be a little bit more anteriorly I can do in terms of a release. But you can see where we are here. And in terms of the cuff, this is it right here. And so sometimes you do a release here. We have to be a little bit careful of the suprascapular nerve down here. But that looks pretty good. Okay, we'll show you some more in a little bit. Okay, so we're set up in the subacromial space now. And I'm just going to try and orient you to where we're at. This big hole is the rotator cuff tear. The camera's coming in from the posterolateral portal. This device you see here is coming in from the anterolateral portal. And we've got a cannula coming in the back right here. I'm just getting our visualization a little bit better so we can show you. Okay. And then we've got a cannula coming in the front, which you see here. And then we've got this yellow cannula, which is our anterolateral cannula right there. And so we measured the tear, and it measured about 3 centimeters in the anterior posterior plane and about the same in the medial lateral plane. So when we look at that, what that means is this re-tear, you can see that's down into the joint. And we measure from posterior to anterior. This measurement at the articular margin was about 3.5 centimeters this way and about 3 medial lateral. So we're going to get to work here. I just want to show you the original dimension. And now really the next step for us is to do our regular rotator cuff repair as much as we can. So we're going to start off by placing some suture anchors in the back and starting to repair the infraspinatus portion of the tendon, which in real terms means that we're going to be starting back here and getting this part of the tendon anchored down to the bone, something like that. And so that's our next step here. Okay, so we've got a spinal needle in here just to give you an idea of where we're trying to place this first suture anchor. You can see there's really not a reattachment that happens until we get way back there, if you look down. So we're going to try and place our first anchor down way back here. We'll show you what that looks like when we're done. Okay, there's the first anchor in the humeral head. Feels pretty solid. Crochet hook, or the straight again. Okay, so here's how we pass the sutures. There's the suture hook. It's got that black wire loaded in it. We're going to bring our grasper in from anterior. Hold the camera right there. And we just want to make sure we're getting a really good bite of this posterior portion of the cuff. And there you can see us way down there. That looks good. That's all the way through. And we'll retrieve that out anteriorly. Go ahead and load. And so that's coming out here. Okay, just hold right there. And as we pull back, you'll see how it brings that black and white suture through. And that gives us our first good bite. So we'll get the partner suture here with the crochet hook. And because this is the most posterior suture, we're going to take it this way. And now when we pull tight on that, you can see how that's going to snug down that tendon just like that, which is going to help us out a lot. Pause. Okay, so there's the first knot tied and cut. You can see how that's given us a really good anchor point. It looks a little bit easier to identify the tear even now. Now we're going to pass that solid blue one next. We'll show you that in a minute. Okay, so we've got our first three sutures tied from the first anchor. You can see them back here. We started way in the back, remember. And then the last suture from the first anchor is that blue and white striped one. So just from those three, you can see the tear looks much more manageable already. We're not done though. We're going to move our spot here, and we're going to place another anchor. Yeah, that looks like a good spot. We're going to place another anchor maybe right about here, close to the articular margin to take any tension off the repair. You can see we've still got to go way up there, so it may even be two more anchors before we get to our graft. So we'll start here though. We'll place another anchor right about there. I like that spot. That's basically right at the mid portion of the supraspinatus insertion, just so you have an idea of where we're at. Posteriors to the left, anteriors to the front, to the right. Okay, so here's the second triple loaded anchor in. You can see our position here. We're going to start passing these sutures next. Okay, here we are, just again, always reducing the tear. Okay, pause please. Okay, so here's our repair. We haven't done the patch yet, but there's the repair. And now we're going to place a patch over the top of that. We're going to measure one more time and see, make sure we get our patch dimensions correct at this point. We know where we started, and that's usually the size patch we want, but we always double check, or most often double check, I should say. Okay, so here you can see what the graft looks like before we fix it. Almost looks like a trampoline in there. And we're just centering it, making sure it looks good. There's 4 sutures around the periphery, and then we're going to place 2 pop locks to anchor it down to the bone. that line there is meant to be the mid part of the tear, and that looks like we're pretty well centered right over the mid portion of the tear, so I'm happy with that. So we're going to start tying these one at a time. We'll show you some more in just a little bit. Okay, so we're all done here. We had to add an extra medial suture because I needed a little more fixation, so that's why I took a little bit extra time. There's 3 sutures medial, 1 anterior, 1 posterior, and then we've got our 2 pop locks, one's there and the other's there. And so now as we rotate this arm, that whole patch looks kind of like a trampoline spread out, but that has good tension on it, and that's all moving together as a unit, and I'm happy with that repair, or augmentation of the repair, because the repair was the first thing that we did. But now we've got a patch on top of that, and hopefully that'll give us some extra strength. So good luck to you now. We're going to get you back to the recovery room shortly. Bye-bye.